Whether acute or chronic, pain is no day at the beach. However, pain is normally a powerful indicator that our body uses to let us know something is wrong. So this natural process actually should never be ignored. Here to share information about the diagnosis and treatment of pain disorders is Dr. Bryan Boerjan, a board-certified chiropractic physician with Gulf Coast Pain Specialist. Bryan, thanks for being here.
Thanks for having me, Jeff.
Well, welcome. A lot of people may just assume that aches and pains are part of the aging process and something that really just has to be tolerated. But as a pain specialist, what's your thoughts on that?
Sure, that's a great question, and a lot of patients that we see, or a lot of people out there, may kind of deal with those normal everyday aches and pains that come along, and we're really there for those patients that have long-standing issues. I think it's important for people to realize once those issues become longer than a week or 2 weeks, it is important to get that checked out by a chiropractic pain specialist or a pain management specialist to determine whether it's an acute issue or if it's something that needs to be evaluated further for something possibly more serious.
So we just shouldn't ignore it and say, this is just something I need to deal with. We need to look into it, right?
Absolutely, and you never know what it could be. It could just be a simple sprain strain, or it could be something much more serious.
So when somebody comes to your office, what could they expect as far as this conversation or this investigation?
Sure, just as they would normally expect with any other doctor's office, we go through a detailed history with the patient and what their complaints may be. We go through a detailed orthopedic and neurological examination. We do a complete workup, and then we'll go through and make recommendations for that patient, whether it may be spinal manipulation, physical therapy, massage therapy, which we have all right there in the office, or it may be we may need to refer them for x-rays, MRIs, or referral to another specialist, pain management, rheumatology, orthopedics. So we really have a comprehensive pain center.
Well, for those who may not be as familiar or have experienced regular chiropractic care, tell us a little bit about the benefits and specifically in dealing with pain relief.
Sure. Chiropractic care is a very safe and effective, proven method for pain relief, and specifically for the aging population. Something that we see quite often is arthritis, and there's various forms of arthritis, osteoarthritis being the most common, or sometimes called degeneration. And chiropractic care is very safe and effective for this type of condition. We use various forms of manipulation, various gentle ways of adjusting. Some people aren't too keen on hands-on manipulation, so we have various forms of manipulation for the patient so that they're comfortable with that. And then we complement that with physical therapy and other types of modalities.
Mm-hmm. So what about like knees, wrists, elbows? Is this, I always think of it as being more spinal or that kind of thing, but specific areas?
Sure. A lot of people think that we just deal with backs and necks, but we also deal with a lot of extremity problems. Again, chiropractic manipulation is very effective for increasing joint range of motion and decreasing pain with that range of motion. So whether it's you're trying to go out in the garden and work all day in the garden and have less pain, or pick up your grandkids, or hit 20 yards further out in the golf course, we really try to increase your ability to do those things so you can get through the day with less pain.
Well, you mentioned some of those intangible benefits, lifestyle related. What's some of the feedback that you hear from some of the people that you see as far as how they felt about the experience and what it's added back to their life?
Sure. We've gotten some great feedback from patients because we really try to go through with patients and teach them how to do things safely outside of our office, because really we only see them for a short period of time. So we want to try to teach them ways to avoid getting injured in the future, and we're always there if they need us. We also try to teach them other natural pain relief solutions. We do go through natural supplementation or go through exercise, and oftentimes recommend pool therapy and other options. So we really try to give them as much information as possible.
And I'm sure it's like anything else. We succeed better if we follow the instructions, right?
Absolutely. Sometimes that's half the battle, but I really, to be honest, patients that follow our recommendations really do very well.
Well, tell me a little bit about the whole staff that y'all have. I think you've got a whole team assembled there. Is that correct?
That's correct. We're at the Medical Center Clinic. We're with Gulf Coast Pain Specialists and work alongside pain management specialists, board-certified anesthesiologists. So we work hand in hand with patients' treatment plans, and we work with a physical therapist, massage therapist, and we also, like I said before, we work with our rheumatology department, orthopedics, and different specialists. So we really try to work with patients, other doctors, to really keep them informed of what their treatment care is going on.
Well, for somebody who may have been to a variety of different types of doctors but not really had chiropractic care before, what kind of questions do they typically ask? What are their concerns?
Sure. Many times we see patients and they've never been to a chiropractor before, and some patients don't realize you don't need a referral to our office. Even if you're on Medicare, Medicare does not require a referral to our office. So many times we'll get questions as to what care is going to consist of. Will it hurt? It is a big one. And really, how long will treatment take? And those are very good questions, and oftentimes we go through an initial treatment process to see how a patient will respond initially to care and make further recommendations upon that. And also, as I mentioned before, we've got various forms of treatment, being very safe, gentle forms if need be. We see patients with osteoporosis, and we're able to effectively treat them in a variety of other conditions. So those are really the big concerns, I think, and also just having their other doctors aware of the treatment that they're receiving.
Well, you mentioned Medicare. What about other insurance plans that may be out there?
Sure. We're contracted with many other insurances. A lot of people in the area may think that chiropractors see mainly motor vehicle patients, sports injuries, and daily aches and pains, but we really do see chronic issues as well. So many commercial insurances, Blue Cross Blue Shield, Aetna, Humana, and even Medicare replacement plans. We were contracted with all those insurance companies. So we'll verify your insurance for you and make sure that you've got coverage.
Great, great. Well, so if somebody is watching this program and experiencing pain and saying, okay, I don't have to tolerate this, what should they do? How can they reach you?
They can go online. They can go to our website, www.gulfcoastpainspecialist.com. They can find us on Facebook if they're on Facebook as well, under Gulf Coast Pain Specialist, or they can contact our office with our phone number on that website as well. But I would just like to say, patients don't need to go through and deal with these everyday aches and pains. We'd love to help you in any way we can.
Great. Well, Bryan, thank you very much for being here, and we appreciate it.
Thanks, Jeff.